CrossFit has always had a bad rap in the medical community. It's too dangerous, people get hurt all the time, they keep us in business, blah, blah, blah. But I've never seen it more apparent than in the physical therapy space. What? In all honesty, I've basically seen a complete disregard for the passion and the love of fitness that CrossFitters have because they've already predetermined that this is a dangerous sport and people shouldn't be exercising that way. I've also seen the flip side of this. I see trainers and coaches who are frustrated by physical therapists who have been stuck in the dark ages of traditional therapy where they're not focusing on the movements and the intensity of the things that these athletes are doing on a day-to-day basis. And when athletes are injured, they're not really getting the care that I think they deserve or the coaches think that they deserve. So there's been this butting of heads between physical therapy, strength and conditioning, CrossFit training, and I want to take my personal experiences of being a CrossFit coach and a physical therapist and sort of blend them together for you. The question is, who's right, who's wrong, and is that even relevant? I'm going to give you my thoughts in today's video. What's up everybody, welcome back to yet another episode of Excellence in Motion. I'm Doc Caden, and I'm here to inspire you to achieve your potential through movement. Today's video is sponsored by... Oh wait, not yet. We'll get to that in future videos. Over at NRG Physio, we tend to blend the lines between strength and conditioning and physical therapy pretty heavily, and that's because of our intentional reach in the CrossFit space. We've noticed for a long time that there's a huge discrepancy between the functional fitness athlete and the rehab world. A common thing that we hear from a lot of athletes who've gone to rehab for any number of injuries is that when they're hurt doing something, their physical therapist just tells them to stop doing the thing that makes them hurt. And for us, that's a huge red flag and a big indicator that they're not going to the right type of person, because that person, while knowledgeable they may be, doesn't quite understand or get the intention of the functional fitness athlete and needing to be able to move even if it's with a little bit of pain. Let me speak from the traditional physical therapy side of things. We're taught in physical therapy school that pain is associated with weakness or dysfunction somewhere in the body. So a traditional therapist is going to think, okay, there's probably a muscular imbalance somewhere, there's pain associated with that, probably some weakness there, so if I'm going to make this athlete better, I'm going to have them stop doing the things that make them hurt so that they can get adequate rest and get back to functioning later on in life. The big problem with that is that pain and weakness are not directly correlated with each other. What? In our practice, we've seen lots of elderly patients who are extremely weak when it comes to muscular strength, but have no pain whatsoever. Likewise, we also see young, strong bodybuilder type athletes who have incredible strength, but are in pain all over the place. So the two don't always add up, and if we're always correlating pain with weakness, we're missing the mark entirely, and that's where I think the CrossFit athlete and the CrossFit coach gets really frustrated with traditional physical therapy. Yep! From the athlete and the coach's side of things, I understand why there is a disregard and almost a little bit of an apathetic feeling towards going to a rehab specialist, because they're not going to the right people. They're going to people who don't understand what these functional movements require and how to teach them to be able to manage their pain in easy ways so that they can continue to do the things that they want to do without having to back off on too much of the intensity and the load. The butting of heads between CrossFit and physical therapy really is created by the lack of understanding from both sides of how to work together to create a harmonious bond. In my opinion, I think the reason that physical therapy and CrossFit continues to not be able to get along is partially because the physical therapists are not paying attention to what the needs of the CrossFit athlete are, and that's something that needs to change. For the CrossFit athlete, it's their responsibility to understand if they're doing CrossFit for fitness or if they're doing it for competition. Because in this whole conversation, everything changes when you consider CrossFit as an exercise modality versus CrossFit as a sport, and that's a big difference. CrossFit as a sport is just like any other sport. It's competitive, it's intense, and it does have its own fair share of injuries, which, if you look in the research, is incredibly low compared to other sports like soccer, baseball, and football. But when you look at CrossFit as an exercise regime and an exercise modality, the injury rates are a little high, and I think that's partially on the fault of CrossFit. CrossFit coaches don't know how to differentiate between the athletes that are just doing this for health and fitness and the athletes that are doing it for sport. And I think making that clear divide right down the middle and changing the goals in workouts based on those things is incredibly important. The CrossFit athlete who wants to compete and push the intensity and push the envelope and get strong, physical therapists need to know how to treat that athlete, and so we can keep them going towards their goals in a way that allows them to manage their pain and move through it. The CrossFit athlete who's just doing it for health and longevity, it's a little bit of a different ball game because we're playing on that low trajectory across a distant horizon towards wellness and fitness, and we don't necessarily need to be giving a high intensity 5 days a week in the CrossFit gym. From my perspective as a CrossFit coach, I love communicating to my athletes that you don't need to be 90 to 100% of your intensity every single time you're in the gym. Sometimes staying in those lower ranges of 55 to 60% is perfectly fine for how your body is feeling, and that's what's going to allow us to keep moving forward day after day. Making smart modifications and adjusting for painful stimuli is going to keep us in the gym a lot longer. So really, the solution to this whole feud between the two comes down to both sides recognizing where their limitations are in their understanding of each other and finding ways to collaborate and work together in order to achieve great outcomes for both the athletes and the healthcare providers. NRG Physio is starting to blend those two together, and we're really happy and excited to be able to work with this type of population of people because we have a lot of knowledge around how to treat a CrossFit athlete and keep them healthy moving forward. If you're watching today's video and you're a functional fitness or CrossFit athlete, keep watching more videos because if you subscribe to this channel, I'm going to give you a lot more of the tips and tricks that we use at NRG Physio to keep people going, keep them out of pain, or teach them how to manage their pain in an appropriate way so that they don't have to stop doing movements like squatting and pressing and deadlifting. If you're a healthcare practitioner or provider or physical therapist watching today's video, I invite you to find a way to understand these athletes, learn more about what CrossFit is and how it treats people so that you can adjust the way that you treat these athletes and allow them to keep doing the things that they want. Nobody likes having someone tell them that they need to stop doing the things that they love and that they're passionate about. If anything, that's more detrimental to patient care than it is to just let them move through and find ways to work around the stuff that they're dealing with. In the end, it comes down to total collaboration between the two parties, and I don't think either one is right, and I don't think either one is wrong. It's more or less how do we understand each other and move forward from there. That's my 2 cents on the whole topic. This is coming from personal experience as both a CrossFit coach and a physical therapist. I see this stuff day in and day out, and I think if we can find a way to get these two worlds to coincide together, we might find a way to actually have a huge surge in health and longevity across all athlete populations. Physical therapy doesn't have to be boring, and CrossFit doesn't have to be dangerous. We can find ways to work around both of those common stereotypes and improve both sides of the coin. If you enjoyed today's content, please consider giving it a like and commenting down below your thoughts on everything that we talked about so far. If you like videos like these, you can watch more of them over here. And until next time, go out, do good things, and don't forget to move. I'll see you in the next video.